The next talk is minimizing the risks of SUDEP. It is definitely not the happiest talk, but is most definitely important and a huge part of why we do Epilepsy Awareness Day. It's just far too many lives are lost to seizures that could have otherwise been prevented with a seizure detection mat and just more education and knowledge. The two speakers that we're bringing up are, they're very close to us. They have been our founding partners and helped us launch this event before it was even an event. They had the foresight to know that it was going to turn into something good, and I'm very fortunate that they supported us and really brought a lot of people and got us national attention. So I would like to introduce Tom Stanton and Cindy Mitchell from the Danny Did Foundation and Julie Hutchison from the Chelsea Hutchinson Foundation. Why is Cindy hiding?
She's just going to observe.
Okay.
Thanks, you guys. Thanks, Brad. So thanks, everybody, for being here. We're excited to be a part of this and to have such a great turnout. I always like to start with just sharing our story of my nephew, Danny. So Danny was the third of 4 kids. He had older sister, Mary Grace, older brother, Johnny, and a younger brother, Tommy. So 2 years apart, each of them. Running mates, best friends, ran around the neighborhood together. Besides for his seizures, he was a really healthy child. He didn't have other health complications, loved sports, smart, loving, really outgoing kid. And so Danny had his first seizure when he was 2, while he was sleeping. And his parents found him, and he seized for about 10 minutes. They went to the hospital. Left there really scared, feeling uninformed. They didn't have information, materials. They didn't feel like they had a good grasp on what to do next or sources for support in terms of advocacy. So Danny started sleeping with his parents, like a lot of kids that have a seizure while, during sleep. His second seizure happened about a month later, and at that point he started taking medication. He had 2 more seizures in his sleep, and his parents had caught those. He had gone back to his own room, and they were doing bed checks constantly, like a lot of families and parents that you know. And then he went about 18 months without any known seizures. They may have, in retrospect, maybe they had missed some, but they didn't see any seizures for about 18 months. And then on December 8th, he went to the doctor for a routine visit with his neurologist. Everything seemed to be on track, and they slightly altered the dosage of his medication. And then on Saturday morning, December 12th, 2009, his mom came in and found Danny lifeless in his bottom bunk beneath his older brother, John, and he was lost. So a devastating day for our family. The name of the foundation, the Danny Did Foundation, comes from the last line of his obituary, which his dad wrote, and that reads, "Please go and enjoy your life, Danny did." And so through his life, we want to try to inspire a message of hope and of embracing life, embracing every day, like you all are doing by being here. And so that's where the name of Danny Did comes from. So I just want to talk briefly about our foundation and about SUDEP from the lay perspective. Julie and I are not medical professionals, but we try to act like them sometimes. And then Julie's going to share her story, and then after that, we'll be happy to take any questions if there are some. So the focus of Danny Did is twofold. We don't want to try to do everything. We want to try to increase awareness around the risks that come with epilepsy. So oftentimes a neurologist will talk about risks related to bathing or swimming, the possibility for head trauma, things to consider when it comes to driving or different forms of exercise. But less often is SUDEP discussed. And SUDEP, if you don't know, is an acronym for sudden unexpected death in epilepsy. So just having the knowledge that that is one possible risk that comes with epilepsy is really a big advantage. Danny's parents had never heard of SUDEP before he died, so there was definitely a blind spot for them in terms of the ability to ask questions or get themselves empowered. The other area of focus that we tackle is to increase awareness around devices and technologies that can help to enable early intervention during a seizure. So it's rare that a case of SUDEP is witnessed. So what that tells us is if someone's present in the room, mom or dad, brother, sister, spouse, it's going to be a big advantage for the person who is seizing. Their health and well-being can be checked if someone is in the room to do all the things that you guys know how to do. Make sure they're responsive and their airway is clear and there's been no head trauma. All those things you can do if you're present. So a common question that we get is, what is SUDEP? A death is referred to as a SUDEP when a seemingly healthy person with epilepsy dies unexpectedly and no clear reason for the death can be determined. In most cases, an autopsy is required to rule out other causes of death. The most common criteria used to determine whether a death is due to SUDEP are: the person has epilepsy, which is defined as recurrent unprovoked seizures. The person died unexpectedly while they were in an otherwise reasonable state of health. The death occurred suddenly and during normal activity, often during sleep. An obvious medical cause of death could not be determined at autopsy, and the death was not the direct result of status epilepticus. So those are some of the criteria to decide when a case of SUDEP has occurred. Another common question that we get is, who is at highest risk? Uncontrolled seizures and habitual tonic-clonic seizures at night present two of the greatest risk factors for SUDEP. People who are in both or either of those categories, so a high volume of seizures and convulsive seizures during sleep, are at highest risk. Other risk factors being looked at include epilepsy beginning at an early age, having epilepsy for a long time, not taking medications regularly or as prescribed, stopping or changing medication suddenly, young adult age, which is defined as age 20 to 40, or having an intellectual disability, which is defined as having an IQ of under 70. So a key message that we try to put out is it's really important for patients to talk to their doctor about where they fall within that risk spectrum, or that parents talk about their child's risk level. So this leads to a natural question: how to minimize that risk once you have the information. Unfortunately, right now, there's no surefire way to prevent SUDEP. But we do believe there are ways and tactics that we can promote to patients and families for them to minimize the risk. And I'll give some of those now. So one that we both think is hugely important is advocate for increased awareness by the public and the medical community. So just getting the word out that SUDEP is something that exists. It's a tragedy that touches too many families with an epilepsy, and that we are all urgently pushing for more progress and figuring out what causes it and how can we prevent it. As a community, that's really important that collectively we work on that. Another way to minimize the risk: maximize seizure control via strict treatment adherence. So, whatever your treatment may be, staying on schedule, not skipping portions or days, as much as you can control that. Regular physical activity and lifestyle modifications that reduce stress and seizure activity. Regular doctor visits, especially if convulsive seizures are not completely controlled. And then consider the use of alternative resources such as monitoring devices that detect certain seizures and can alert caretakers and enable early intervention. And related to that, supervision or monitoring during sleep hours to identify seizure activity. And that really is kind of one of the primary focuses of the Danny Did Foundation, is to let families know, here's this whole category in addition to medication, in addition to diet, in addition to surgery, that you should be aware of. And some of these, or one of these, might be a fit for you. At the very least, it's something to investigate. And this category is evolving. You know, what's at market now is what it is, and there's a lot of things in the pipeline that are coming that will be more sophisticated. So another way to minimize the risk, ensure that family members and caretakers have knowledge of seizure first aid and of emergency resuscitation measures, including CPR and defibrillator use. And then lastly, inquire about and advocate for research that enables a better understanding about the causes of SUDEP. So the mechanisms of what exactly causes SUDEP. And that's again where I think parents and families can make a push to really demand that this happens collectively as a community. So I'm going to tackle one more question before I turn it over to Julie, and that is how to talk about SUDEP. So how many people here have heard about SUDEP directly from their doctor? Okay, so a fairly small percentage, and that really is what we hear too from families we talk about and surveys that have been put together. It's a pretty low percentage, but then if you asked how many families would want to hear about it from their doctor, it would flip-flop. You know, and the reality is that although SUDEP can be a frightening thing to talk about, to hear about, parents can take it. You know, parents are in charge of their child's well-being. They, more than anybody else in the world, want to keep them safe. And to not have information about a risk as serious as death is a pretty big blind spot. And as Julie will attest, and my family can attest, to hear about that information after the fact is a whole lot more devastating than to hear about it when you have a chance to do something to try to minimize the risk. So I think parents need to be given more credit in terms of what they can digest and make a game plan from there. So if a patient or parent hasn't been informed about the risk factor from their doctor, that's where the Hutchinson Foundation and the Danny Didd Foundation works to fill that gap. We always maintain that the information best comes from a medical professional, but if they aren't hearing about it from a doctor, and a lot of families are not, then they're left with a blind spot and they're powerless to try to minimize that risk. So this happened to Danny's family and to Julie and Doug's family, and to many more that we've met, unfortunately. So the last bit that I'll share, the way we think it can be positioned is within the context of all the risks that come with epilepsy. So when there's that conversation about driving or you know, head trauma or exercise or swimming, bathing, SUDEP could be included in that conversation. It doesn't have to be isolated or pulled out, but it shouldn't be left out of that conversation. And I think that gives a parent or an adult with epilepsy the opportunity to say, whoa, what was that one? You know, I've got questions about that. Or at least to have it on their radar and to be able to investigate further. So I think that gives a parent or an adult with epilepsy the opportunity to say, whoa, what was that one? You know, I've got questions about that. Or at least to have it on their radar and to be able to investigate further. So that's our position. And you know, the analogy that we use is, in other disease states, you're told the entire spectrum of possibilities that could take place, and that's what we need with an epilepsy. And parents and patients that cope with epilepsy deserve that. So with that, I'll turn it over to Julie to share her story, and then if there's questions afterwards, we're happy to answer them. Thanks very much.
Hello, I'm Julie Hutchison with the Chelsea Hutchison Foundation, and just so you know, because I'm so nervous, I'm picturing you all sitting there in your underwear, and that helps me. But my story is, and I always cry, and I apologize. I'll get over it. I lost my mother to a seizure in 2007, and when I went to her doctor and to my daughter's doctor afterwards to ask what happened, because I was always told that seizures were not deadly. They told me it had to do with my mother's age, it was a fluke, and that I had nothing to worry about, just to watch my daughter around water and know that she could hurt herself if she fell. So we went on along our merry way. Chelsea was very highly functioning. She was a straight A student, the belle of the ball. Everybody loved her. Sorry. And we just thought, we knew. I was never trying to find why or what would happen. We thought we knew. We dealt with epilepsy in my mother from the mid-'80s. And I lost my train of thought, I'm sorry. But we were always trying to find out why she was having seizures. So in 2009, in April of 2009, my husband went down to get her medication for her in the morning, and she had passed through the night, and we were shocked. She was face down in her pillow, which is, we learned after the fact that many SUDEP casualties are face down and appear as though they suffocated. We begged them not to do an autopsy, so her death certificate actually says that she passed by suffocation, but it never made any sense to me because her seizures were short-lived, 10, 15 seconds, and she was back with us in a minute and a half. So it was about 30 days after we lost her that we learned this term, SUDEP. All these people started connecting with me and saying, oh yeah, my brother-in-law died of a seizure, and my sister-in-law, or everybody knew somebody that had died of a seizure, and we'd never heard of that. So we were angry, very angry, because we felt like I was even at the doctor's office asking for the information and wasn't given the information. So we started, when we lost Chelsea, everybody wanted to make donations to something, and it's not something you plan for, so we didn't know. So we just saved the money and knew that we would try to find something to do in her memory. And as time went on, we learned of seizure response dogs, and we thought that was a win-win because of Chelsea's love for animals. And so first we started helping families obtain seizure response dogs. Then we learned of the monitors, and then more monitors. And so basically our foundation now has four different programs. One of them is SUDEP awareness. We raise public awareness. We don't go into the medical facilities like the Danny Did Foundation is. They're so professional, we leave that to them. We raise public awareness, and people tell us every day that they never heard the term until they came across our page, and so they go to their doctors and they make their doctors talk about it. So we feel like we're doing our part there. But the funds we raise, we help people obtain grants for seizure response dogs. We've funded, I think I just paid my 84th grant about a week ago. So it's a labor of love. And we, like the Danny Did Foundation, we help people obtain the different monitors that, in my opinion, are life-saving. We feel strongly that if Chelsea had had a nighttime monitor and we had had the opportunity to either be there with her or save her, our lives might be different today. The other project we've got is along the lines of a Make-A-Wish. It's called, we call it Chelsea's Wish, and we raise funds, and we bring families to this event here from across the United States, all expenses paid. Many of them are single-parent families that could never do this, on their own, or don't believe they could ever do it on their own. So that's what gets us out of bed in the morning, and we feel good that we're keeping our daughter's memory alive. We do a SUDEP awareness walk called Stomp Out Epilepsy and SUDEP. We started in Colorado in one little park, and we've grown over the last 6 years. And in 2016, we'll be in 10 locations across the United States. So we're little, but we're mighty, and we're very loud. But we'd love for you to stop by the table and learn more about Chelsea. And I'm going to give the mic back to Tom now, because he can answer the questions I can't.
So yeah, if there's any questions about either one of our foundations or about SUDEP, feel free to ask them now, or like Julie said, come by our table. We've got information, resources that you can take with you or you can share with your doctor. So we welcome that.
So you said your daughter just had 10-15 seconds and then it gets to have been a sudden death, right? But most risky patients are, like we mentioned, about 2 factors, you know, for the patient.
Mm-hmm.
So I just want to understand a little bit more what kind of patients are in more risk for this kind of.
Yeah. Well, the 2 categories that are discussed as the highest risk are uncontrolled seizures. So if medication isn't working for you, that's something that definitely puts you into a higher risk category. And then if you have convulsive seizures during sleep, that's another category of high risk. And the duration of the seizure, I'm not sure that that's been determined to be as influential. You know, there are short seizures and then there are 10-minute seizures. The biggest thing is that if someone can get into the room, either during a seizure or right afterwards, that's going to reduce the risk a great deal, because you can call 911, you can administer Diastat, whatever the mechanisms that are necessary, you'll be there to take care of.
So this question is for Julie. When your daughter has seizure, was she unconscious or she's conscious?
It was, we actually believe it was the very first nocturnal seizure that she ever had that took her life. Her seizures were mostly in the day, and she actually didn't fall within any of the high-risk categories, and neither did my mother. So she was, it was a tonic-clonic seizure. She bit her tongue badly. But her seizures, she only had probably 3 or 4 a year. She started having them at age 11. She was, a strobe light made her have her first seizure. And, 3 or 4 seizures a year. She had absent seizures probably daily, but tonic-clonics rarely, compared to what so many families deal with. So it was her, they didn't even call her condition, they never used the word epilepsy, they called it a seizure disorder.
Are you able to speak on some of the monitors, the new things that, I have a son, a 7-year-old, who still sleeps in the bed with me because I'm so scared of that. And we use an infant on occasion for naps, but can you talk about anything else that you know of that's come out that could
be helpful?
Yeah.
Yeah.
You know,
yeah, there's a range of things, and I think an important point to make is that both of our foundations, our goal is to share the information with families and let them look into these things, answer questions where we can, or point them to the manufacturer. We don't endorse any particular device because every scenario is different and the needs of the parents are different. So you mentioned the MFIT movement monitor, which is a very thin device that goes between the box spring and the mattress. It's looking for repetitive, consistent movements, and then it sounds an audible alarm if unusual activity occurs for a certain period of time. There's another system called the SAMI alert device. Like the MFIT, it's looking for nocturnal seizures. That one features an infrared camera that's trained on the bed. It sends a wireless signal back to typically mom or dad's room that appears on an iOS device. And when movements occur for a set duration, it sounds an alarm within the parent's bedroom. That also records movement activity. So if you want to share that with a doctor or review it in the morning, you've got the opportunity to do that. There's a device called the smartwatch made by a company called Smart Monitor. That one is for mobile monitoring. So if you're going to school or work, you're out and about during the day, you could wear that, and someone is notified via text message and a phone call when there's movement activity. We've got someone here that's wearing one. Some folks use that. Yeah, if you want to take a first-hand look afterwards, there's a user here. number 2. That's great. Yeah. So those are great for, you know, people that are out and about, and it's like I said, mobile monitoring. Some people do use them during sleep too. There's other things out there. There's a device coming out at some point called the Embrace that you may have heard of. It's also a wristwatch worn device, and it's going to try to measure for more than just movement. So we think the next generation is going to be more sophisticated in terms of looking for more than just movement. You know, it'll look for variance in heart rate, body temperature, perspiration, some other indicators of seizure activity that could be helpful to say either a seizure is going on or a seizure is coming, or what we all hope for, you know, is some kind of system that, you know, is able to suppress seizure activity or say, you know, get into a safe place, give you some kind of warning, either for the person themselves or for a parent or caretaker.
Sammy Alert is here, Smart Monitor is here, and so is Embrace. MFIT is the only one that's not here, but I'm sure you guys have information on the MFIT, and so do we at our table, so stop by and talk to them.
Are you able to speak over the mechanism of SUDEP? Over, like, I know that it's kind of controversial and we don't know if it's like respiratory or cardiovascular, and if these monitors are something that can like trigger, like, what has it ever caught SUDEP in the middle of it happening, or like, you know, where you could get a defibrillator or a, you know, I don't know what the mechanism is and how, because a seizure is one thing, but I think SUDEP is kind of something else, right? It has to do maybe with electric impulses in your brain or something.
Yeah, so you named the main theories. You know, either it's ultimately a cardiac event, or a respiratory event, or some breakdown of the neurological system, or potentially some combination of those three. That's where Julie and I, you know, really have to encourage research, encourage collaboration with medical professionals to try to pin down those answers and kind of install a sense of urgency to figuring that out. What we do know is if there's a SUDEP is typically the precursor is a seizure, typically a grand mal seizure, tonic-clonic seizure, and that if someone can be present, then there's a great advantage to their safety. You know, to take steps that you can take if you're there versus not being there.
So she had a seizure, like, what you could tell during that she had a seizure before that. Because sometimes I've heard that, like, there wasn't even, like, you know, they didn't even find evidence of a seizure before seizure.
Yeah, and I've heard of that too. I think that's still part of the discovery. I think typically there is a seizure that predicates a case of SUDEP.
I was curious if anybody had ever used a pulse ox monitor at night. We have one, and a friend of mine has been using another one, and she said they get a lot of false positives, and so that interrupts the sleep. But do you know of any pulse ox monitors that have been used with better success or could be recommended?
Yeah. Are you talking about the one that just latches on to the finger or the toe, or? Yeah. We've heard of families using those too. I mean, those can be helpful if they'll stay on, and they're not made specifically to detect seizure activity, but if they can help measure variances that indicate seizure is there, then we don't discourage that. There's one company that we list on our website called Masimo, and I can share that information with you. Pulse ox can be difficult to get into the home setting, from what I understand. Usually there's different things that have to happen, but we do talk about those as one possible area of resource for families.
Yeah, because my daughter's 7 and she doesn't necessarily have any clinical manifestation while she's sleeping, but she's vomited, and had I not been in bed with her to turn her, she was flat on her back. And so then when we were in the hospital, it kind of occurred to me, well, why don't we just have a pulse ox monitor at the house, because then what if I didn't wake up, even though I'm right there, and it just stops breathing. So I was just curious if anybody's had better luck with it, or...
Yeah, that's I think kind of speaks to the need to measure for more than just movement.
Yeah, right, yeah, nothing.
Yeah.
I was just going to share that we use a pulse ox also because our daughter's seizures, there's no repetitive movement, so none of the other devices would work for us.
Yeah.
But the pulse ox, even though there are false alarms and it does wake us up, it's worth getting up, you know,
Yeah.
making sure it's on her finger, and
Yeah.
and we use that too because her heart rate jumps up when she has a
Yeah.
seizure.
Yeah, I think heart rate's going to be an important thing to work into some of these new devices.
And her oxygen drops a lot too.
Yeah. Okay, well, I think we're on to the next speaker, but thank you guys. We're going to be around all day if you have other questions. Thanks so much.